The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name is Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We are covering a topic we do quite a bit on, drug pricing. Back on February 21st in a podcast, I talked about round 2 of Medicare negotiations that were going to commence in 2025. On February 28th, I sort of prognosticated that Trump will, in fact, tackle drug price reform, which might have seemed surprising to many. Just recently, a week ago on April 25th, the podcast talked about Senator John Fetterman's opinion piece in the New York Times and his push for GLP-1s and Medicare for obesity, and why I thought the time wasn't right, although I agree with him in principle. So today, the May 2nd edition, we are going to be talking about Donald Trump's recent executive order on bringing the prices of drugs in America down. And in many ways, this executive order underscores my prediction back on February 28th that the president would be tackling drug price reform. We'll take our standard 3 breaks here, so we'll break it up in about 4 parts to make it a little easier to listen to and give some breaks. So let's dive right in. And essentially, I'm saying we should expect big things from Donald Trump on drug price reform because of this executive order. And this executive order is both populist and it actually shows a great deal of policy sophistication for a president that is not really known as a healthcare guy, so to speak. Despite Donald Trump's drug price proposals during his first administration, many felt like the president in his second term would shy away from attacking Big Pharma and potentially even work against the Inflation Reduction Act's Medicare drug price negotiations. After all, he went back and forth on the drug price issue during the presidential campaign. However, since retaking office, Trump has sent clear messages he wants to pursue drug price reform in America. First, after taking office, the Centers for Medicare and Medicaid Service issued a statement indicating it was readying and taking seriously round 2 of Medicare drug price negotiations, although it did say it wanted greater transparency and input. Next, on Super Bowl Sunday in late January, Trump appeared on Fox News bemoaning the price of GLP-1s. He even quoted statistics that GLP-1s in America were 10 times more expensive than prices in the UK. Now, he has issued an executive order on drug price reduction that should send shivers down the spines of big pharma executives. While the order seemingly could lead to one compromise with brand drug makers on so-called small molecule drugs, overall it sends yet another signal that lower prices for drugs in America will continue to come to embattled consumers. As is often the case with Trump, executive orders and declarations, details can be sparse. But if you read the tea leaves of the executive order, Trump promises radical action. It is both politically populist again and shows a great deal of policy sophistication, as I noted. The order also touches yet another critical issue to healthcare reform, the sorry state of employer coverage. So let's take this apart piece by piece. Let's first talk about and refresh on some of Trump 45's drug price reforms. So in Medicare, Trump created the first steps to capping insulin cost sharing in Medicare Part D through a pilot he proposed and implemented. This led to broader action by Biden in the Inflation Reduction Act. Trump created a state waiver process to pursue importation of drugs from foreign countries. Thus far, the program has failed to have major impact. Trump also took several actions to promote the uptake of generics and biosimilars. Trump proposed passing through rebates at the point of sale in Medicare Part D by removing the safe harbor that applied to manufacturer rebates given to pharmacy benefit managers, or PBMs. The program was abandoned due to what would have been increased costs to the federal government. Trump also passed a rule to set Part B drugs based on international reference pricing, where prices in America would be tagged to the lowest prices in other developed countries. Trump also said he would like to extend the program to Part D. The proposal for Part B medical drug was pulled back by President Biden due to various challenges in its setup. And last, from Trump 45, Trump also started major transparency initiatives for health plans and hospitals. So with that sum up of what we're going to look at today and some of what Trump 45 did on the drug price front, we're going to take our first break. And when we come back, we'll deep dive into the executive order. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about President Trump's recent executive order on drug price reductions or reform. I promise to start off our deep dive into the executive order now. So let's take a look at the president's new executive order and its potential significance. Let's first look at Medicare drug price negotiations and what the executive order says. Well, the executive order calls for improving the transparency of the Inflation Reduction Act's Medicare drug price negotiation program. This is where it gets a bit nebulous and could include both positive and negative changes to what is in law today. The order calls for the following. First, prioritizing the selection of prescription drugs with high cost to the Medicare program. Number two, minimizing any negative impacts of the maximum fair price on pharmaceutical innovation within the United States. Number three, it seeks to stabilize and reduce Medicare Part D premiums. Number four, it seeks to modify the program to align the treatment of small molecule prescription drugs with that of biological products and ending the distortion that undermines relative investment in these small molecule drugs. Fifth, it proposes to develop and implement a payment model to improve the ability of the Medicare program to obtain better value for high-cost prescription drugs and biological products covered by Medicare, including those not subject to the program. So on one hand, the order could lead to small molecule drugs getting a longer period of time of protection from negotiations in the law. At the same time, it could also be possible that Trump could harmonize protection periods by reducing the protection period of other drugs. The order also seems to contemplate a revamped way of negotiating prices in large measure because the initial year of negotiations reduced net prices by only about 22% on average. Could this mean the return of an international reference pricing approach in some form for both Part D and B drugs? As much as brand drug makers dislike Biden's drug price law, they would hate if international reference pricing became the way to establish prices in Part D. Again, international reference pricing is relatively simple compared with the current negotiation process and would shine a clear light on the huge price disparity between America and other developed countries. Whether international reference pricing is the solution or not, Trump's reform in the executive order could throw out the entire gross and net price system we have for brand drugs by eliminating rebates. The reference to stabilizing premiums is interesting. This was also in the IRA and not technically tied to Medicare drug price negotiations. But as I have noted often, Biden and Democrats engaged in blatant politics when they passed the Part D cost-sharing reductions in the IRA. The changes were unfunded and have led to the threat of major premium increases in the standalone Part D or PDP program, as well as benefit reductions and cost-sharing increases in Medicare Advantage and PDP. To stop a huge surge in premiums because of that Part D cost-sharing reductions, CMS put in place an extra legal program to fund premium reductions for 3 years in the PDPs. Trump had no choice recently but to declare that he will continue the program into the second of 3 years. Trump's executive order is attempting to determine the long-term damage done by Biden's and the Democrats' unwise and political cost-sharing reduction law. So with that first section of the executive order discussed, we will take our second break and we'll come back to cover more of the executive order. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about President Trump's recent executive order on drug price reform. The next topic of the executive order we'll cover here is investigating and realigning hospitals and other entities' acquisition costs, payments, and charges for drugs to consumers. The order also zeroes in on hospitals and other entities' costs of drugs and how much they are paid and actually charge consumers. The order calls for an investigation to determine the hospital acquisition costs for covered outpatient drugs at hospital outpatient departments. We know that many hospitals get 340B and other discounts and yet are paid high reimbursement through Medicare. Some studies suggest acquisition is 35% lower than what the government currently pays. There also is concern that hospitals do not discount drug costs for lower-income consumers as the program envisioned. Post-analysis, the government would recommend payment changes. In a related move, the government would be required to ensure that community health centers, which also access deep 340B discounts, make insulin and injectable epinephrine available at or below the discounted price paid. One can view the order as putting hospitals and other entities like community health centers on notice that the 340B program's purpose will no longer be ignored and that deep reform may be coming. The executive order also references site-neutral payment reforms potentially at hospitals. If 340B reform was not enough, hospitals have to be reeling from the orders mentioned, of site-neutral payment reform. In past Congresses, proposals were made to begin site-neutral payment reforms, but little has really gone forward. This included equalizing drug administration of cancer and other drugs between hospital-owned facilities, other ambulatory centers, and physician offices. If this were passed over time, it would save billions of dollars. With more and more physicians being taken over by health systems and being directed to practice at high-cost hospital-owned settings, this is a critical reform that needs to occur. Costs are increasing dramatically because of excessive hospital payments for drug administration. Further, cancer patients on Medicare and commercial coverage are paying astronomical cost sharing because of these very high payments at hospital settings. This could be the camel's nose under the tent for broader site-neutral changes. Perhaps initially, equalization of payments across places of service is set for Part B medical drug administration, but later, greater site-neutral payment reforms are made across all kinds of services. It would be undesirable from the hospital industry's perspective, but very good for consumers and the American healthcare system as a whole. The executive order also references Medicaid rebates, and the order would also ensure that manufacturers pay accurate Medicaid drug rebates, that it would promote innovation in Medicare drug payment methodologies, and link payments for drugs in Medicaid to the value obtained. It would also support states in managing drug spending. The order would also seek greater discounts in Medicaid beyond the Medicaid rebate amounts for extremely expensive drugs in Medicaid. There are existing programs for some drugs in place today that could serve as a model. Next, let's talk a little bit about how the executive order calls for reforming the drug channel. Showing how sophisticated Trump's approach is, a huge priority is being placed on reforming the drug supply channel overall. The order requires recommendations on how best to promote a more competitive, efficient, transparent, and resilient pharmaceutical value chain that delivers lower drug prices for Americans. We know that the drug channel is opaque and stakeholders have little understanding of the financial and contractual arrangements of the myriad middlemen, including PBMs. These arrangements include rebates, concessions, and more. All these drive up overall costs to consumers, employers, and the government. The order more specifically requires transparency regarding fee disclosures among PBMs, insurance plan sponsors, drug manufacturers, and pharmacies. The order also attacks the issue of antitrust concerns. It requires recommendations to reduce anti-competitive behavior from pharmaceutical manufacturers. With that explanation of the drug supply channel reforms in the executive order, we'll come back to continue on with some additional explanations and conclude the podcast. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about President Trump's executive order on drug price reform. We've gone through what he did back in Trump 45 on drug pricing, and we've sort of worked our way down the executive order. And now we're going to sort of sum up and then conclude. The next topic addressed in his executive order is promoting biosimilars and generics. While some reforms have occurred here, the order would go further by requiring administrative and legislative recommendations to, First, accelerate approval of generics, biosimilars, combination products, and second-in-class brand name medications. And number two, improve the process through which prescription drugs can be reclassified as over-the-counter medications. We know that there are numerous further reforms that can be made to clear the way for greater numbers and penetration of generics and biosimilars. These include Orange Book reform in attacking regulatory thickets, constraining brand drug maker lawsuits and other arrangements that stop timely generic introduction, other regulatory and approval reforms, and physician education on biosimilars. Next, we're going to mention importation. The executive order really wants to go further down the road of importation of drugs. We know that this, however, has a number of complications and barriers. Trump again, though, wants to promote the issue as one solution among many others. Foreign governments, especially Canada, are concerned about impacts on their domestic supply from U.S. importation laws. Last, let's close out here on employer coverage reform, and this ties into something we mentioned earlier. A great deal has been made of late about the lack of transparency in employer coverage arrangements between self-insured employers and health plans, or PBMs, that are administering health care for those self-insured funds. Employees are now suing employers and arguing that their employers are not taking seriously their fiduciary duties to ensure low-cost and quality health care. To tackle this on the drug front, the executive order would improve employer health plan fiduciary transparency by requiring disclosure of direct and indirect compensation received by pharmacy benefit managers or health plans on covered drugs. This could be an initial first step to something much broader on fiduciary transparency. So, what can we make of all this to conclude? Few expected that Trump would end up here at all, and certainly not so fast. Usually uninterested in healthcare policy, it is more of a political issue for Trump. He and his policymakers have outlined a rather far-reaching approach to drug price reform. It spans so many of the current issues, creating high prices for consumers, the government, and employers. They include keeping the drug negotiation law, but going further to get more aggressive on final price, implementing 340B and related program reforms to ensure hospitals, community health centers, and other entities offer prices that are low for those most in need, as well as for savings to the government. Implementing site-neutral reforms on drug administration, reforming and bringing transparency to the drug channel, and fostering additional biosimilar and generic adoption and acceleration. With the Trump order out, this could make it easier for some of these reforms to be adopted in the coming budget reconciliation bill as well. But even if they don't all make it in whole or part in a reconciliation bill, the order, as well as coming reports and recommendations, lay out a foundation for a comprehensive reform of the drug channel, pricing, and costs. I certainly applaud the president's executive order here. Populism has met policy in a major way here. With that, we will conclude this edition of the Healthcare Labyrinth podcast. We hope you enjoyed it, and we'll see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.